It's 12 hours.
In today's seminar, actually, I think we have a very interesting topic about HIV. So we have so big lucky here because professor, not just head of department from nurse, but also if I look from the CV, have many article that already published. Then I think with Professor Konaying expertise, our attendance can be enhancing not just knowledge but technical competence, but also technical competencies in this area. I think we do not want to take too much of your time. So thank you once again to organizing committee and steering committee to arrange this seminar. So now officially the international seminar on HIV can be begin. Thanks. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much for Professor Dr. Eka Ananta to give her speech and open this event. So next, we move to documentation session. So for all the participants, let's we to take a picture together. So prepare yourself. Our team will be take the picture. Please open your camera.
Ya, jadi kepada seluruh para tamu yang berbahagia dan seluruh partisipan yang ada di Zoom meeting kita akan melakukan sesi dokumentasi bersama. Diharapkan untuk mengaktifkan kamera jika tidak berhalangan. Mohon dengan kamera untuk melakukan dokumentasi bersama. Untuk dokumentasi akan ada beberapa slide. Ada beberapa slide akan kita informasikan. Untuk slide pertama, diharapkan untuk memberikan senyum terbaik dari rekan-rekan semua. Kita akan menghitung 3, 2, 1. Slide 2, 3, 2, 1. Slide 3, 3, 2, 1. Slide 4, 3, 2, 1. Slide 5, 3, 2, 1. Thank you so much. Okay, ladies and gentlemen, now we come into the main point of International Webinar 2021, Institute Health of Technology and Science Wiyata Usada, Samarinda 2021. With our first speaker from National Chengkung University, Professor Konaying, Teacher of Nursing, PhD, with the topic Implementation for HIV Prevention in Taiwan. With moderator, Nurse Wahyu Dewi Sulistyorini, Bachelor of Nursing, Master of Science. Nurse Wahyu Dewi Sulistyorini, with moderator, time is yours. Hello, Nurse Wahyu Dewi Sulistyorini.
Thank you. Yeah, thank you for your introduction. So, can you hear me?
Okay, ladies and gentlemen, the first speaker from National Chengkung University of Taiwan, Professor Konaying, Teacher of Nursing, PhD. Okay, with moderator, Nurse Wahyu Dewi Sulistyorini, Bachelor of Nursing, Master of Science, Lecturer of Institute Health of Technology and Science Wiyata Usada, Samarinda. Hello, Nurse Wahyu Dewi. Yeah. Yes. Sorry. Sorry, Nurse University, I don't hear you. Okay. Okay, hello. Can you hear me?
I cannot hear Debbie.
Okay, so now can you hear me, Professor?
Yeah,
Okay,
hi.
hello.
Nice to see
I'm so
you.
happy to meet you again, Professor.
Yeah, me too.
Thank you very much for joining in this international conference. And thank you also for our Master of Ceremony, Hendro, and also Yulita, that delivering this section. And it is an honor for me to be a moderator in this International HIV/AIDS webinar 2021. With the topic is trend and issue of HIV/AIDS and how to reduce the stigma against people living with HIV/AIDS, that hosted by Institute of Health Technology and Science, Wiatau Samarinda. And in this first section, we will understand more about the prevention of HIV/AIDS in other countries, especially in Taiwan. So I will invite our distinguished speaker in this first section, Professor Ko Na-ying. I'm so happy to meet you again, even though only in this Zoom, Professor. So firstly, I would like to deliver your curriculum vitae in a briefly. Professor Ko Na-ying is currently a distinguished professor and also director of the Department of Nursing in National Cheng Kung University, and her clinical research specialization including health behavior and health disparities with a special emphasis on vulnerable population affected by HIV/AIDS and emerging infectious disease such as MERS, dengue fever, Zika virus, or COVID-19. And Professor Ko also served as one of the key advisors to the Ministry of Health and Welfare, Taiwan Center of Disease Control, and also Ministry of Education on HIV/AIDS issues. She also was the International Council of Nurses delegates and trade meeting of ICN, ICM, and WHO in 2018. Dr. Ko contribute on global health and achieving sustainable development goals in training and empowering healthcare professional and future nurse leaders from China, Kenya, Myanmar, Vietnam in disaster management, leadership, and prevention also. She was a certified LFC trainers and provide training in nurse leader from Myanmar, Indonesia, and Vietnam. She also served on the editorial board of many journals and as author and co-author for more than 200 scientific publications, including several textbooks. So it is very proud for us to invite Professor Ko as our speaker in this main session. So Professor Ko Na-ying, time is yours.
Thank you for David's introduction. It's really nice to see NCKU alumni and then also have such a wonderful event. And yeah, this is to say because we are the sisterhood. Yeah, we have MOU, so I think that is part of my honor to share with you and to see how do we work together. Okay, and I would like to briefly introduce myself. As Dewi already introduced, I am HIV and AIDS expert recognized by International Council of Nursing, and because HIV is an infectious disease, especially emergent infectious disease, so during COVID-19 pandemic, I'm also a very famous and important consultant in Taiwan. Yeah, not only for nursing, but also for the policy. And yeah, I think for the policy, I just want to mention in HIV, I am the policy sponsor to initiate HIV test and counseling program in Taiwan in early 1995. And then I proposed a HIV case management model, and 2010 become a national HIV policy in Taiwan. In 2009, I think the long-term care will be a very important issue. So I start to establish long-term care for people living with HIV in Taiwan. And for the PrEP, yeah, I advocate for pre-exposure prophylaxis in 2010 and 12. And then later in 2015, that launched up in Taiwan. So in 2016, Taiwan is the first country in Asia founded by the PrEP program founded by Taiwan CDC. Yeah, and recently, which means this year, we have redefined the risky behavior. We cooperate with the U equal to U, undetectable equal to untransmittable into the law. Yeah, so that is important policy, HIV related policy I have done in Taiwan. Yeah. Yeah, I haven't to tell you. Yeah, I am the chairperson of HIV policy in Taiwan. So actually, I am a very influential person since I was working HIV. Yeah. So for the and NCKU is for the THE impact ranking is ranked first in Taiwan, and all over the world is around 100. And the impact ranking, which means SDG, so that is very important issue in global. Also, is the main effort has been working in NCKU. And before that, I want to let you see the I don't know. Can you hear the voice? No, I don't think so. Wait a minute.
Yes, I'm sorry, we cannot hear the voice, but for the picture is clear, Professor.
Yeah, okay. So, yeah, let me see. Okay. Oh, I forgot to share with you. Okay. So,
Yes, we hear the voice, Professor.
Yeah. So I would like to start to share with you my story. Actually, I am a very early pioneer to working on people living with HIV. So when I was in college, third year, so I met my first AIDS patient. And after I graduated from graduate school, I finished my master program. So you can see the photo in the middle. Oh, okay. So, oh, okay. So can you hear me now?
Yes.
Okay. Uh-huh. Yeah. So I was a college student. At third year, I take care my first AIDS patient, and then you can see in the middle, uh, Dr. Zhuang, Professor Zhuang. He is our AIDS father in Taiwan. He diagnosed the first AIDS patient in early 90s and then become a very important person. He and another prestigious scholar invite me to open the AIDS NGO to take care for AIDS patients. So that is in 1995. So you will know, yeah, I just grew with HIV. After 1995, I I am the founder of AIDS NGO called HOPE, yeah, since 1999. But after that, you will see I also have established three important institutions. One is Sunshine Career Center, that is LGBTQ health center for gay, lesbian, transgender, for those sexual minorities. And for the middle, that we call South Rainbow Street, that is another LGBTQ center. And in 2007, I established a new center that is specially for the cancer. So right now, under Love and Hope Association, we have three important center is all affiliated with Love and Hope Association, that is HIV NGO. But I'm also a clinician. Yeah, so I saw patient in clinic, and then I take care of patient in hospital. So you will see that is children with HIV with her mother, and then we take care our patient as a team. Yeah. And you will see the mother and the children that have a family. So we always take care of those patients as a family-centered care. And our team award a lot, many awards, and those are national awards. So that is 2010. 2011, we award National Safety and Quality. one pill a day keep HIV away. Again, once daily, one pill a day keep HIV away. So the effective is up to 92%, and it's only easy and simple who take it. HIV people who check the HIV test and not negative, so HIV negative person. And where to access? Yeah, in Taiwan, of course, NCKUH is the first hospital to launch up the program, because I am the people to advocate and sponsor the policy. And right now in Taiwan, all over the Taiwan, including in East area, we do have a hospital. Right now we have a 38 hospital over the Taiwan. We provide PrEP program. And so that is for the HIV negative, what service we provide: HIV testing and the PrEP, and also the counseling. Yeah. So how about people who diagnosis with HIV? Yeah. Of course, we have a program we call case management program. Yeah, we start from they test, and then they will encounter HIV testing the staff, and then if they are test positive, and then the staff will refer the patient to our case manager, and our case manager will lead them to the clinic. So, from testing, diagnosis, and seeing the physician, and take the first HIV drug only one day. Yeah, so we work as a team, and they all supervised by Chief Cole and me. So we have a very good teamwork. So for the people living with HIV, I think that is important is to treat early. So how do we treat early? Yeah, in WHO 2015, yeah, we recommend if patient diagnosed with HIV, no matter their CD4 number, we need to give antiretroviral therapy as soon as possible, just right away. So test and the treat for all HIV positive person become a principle for HIV treatment. So viral undetectable become optimal goal to achieve. So U equal to U, undetectable equal to untransmittable, which means a person living with HIV, if they under treatment and their viral is undetectable, which means they will not transmit the virus to their partner. So U equal to U become a very important issue. As I mentioned at the beginning, we just changed the law. Yeah, we changed the definition of risk behavior. If they are under treatment and then their viral is undetectable, even they don't use condom, we don't treat it as a risky behavior. Yeah. So who have risky behavior, which means they don't have treatment, they have viral and they become risky. Yeah, so that is very important milestone in Taiwan, because we change the law and then they become, that is the first step. We do the discrimination, we against the discrimination for people living with HIV. So drop their viral and become undetectable, become an important goal, and also the optimal goal after the diagnosis with HIV. Yeah, so why undetectable are so important? As I mentioned, because without viral load and if their viral is undetectable, they want to destroy their immune system, and they have better health. They can go back to work. They can become productive in society, and they look like a normal person. And also, they will not transmit HIV to others. So in Taiwan, we provide single tablet regimen, which means 1 pill a day, and treat HIV. So we also, you can see there are many options, many different SDR. So we provide SDR since 2010, is more than 10 years. So based on different people, we using different SDR. And those treatment fees are covered by Taiwan CDC at the first 2 years, and later on covered by National Health Insurance after 2 years of medication. So right now
Professor, I'm sorry. I just remind
Hi.
that the time is 5 minutes left.
Okay. Okay. Yeah. So the other is we are talking about the long-acting injection drug. So right now we are sending to Taiwan FDA, and after this drug has been approved, and they only get a shot once a month. Get a shot once a month. They don't have to take medication anymore. Yeah, so that is will be the brainstorming, the milestone, yeah, in Taiwan treatment. So you will see, yeah, we have a team, we work together. Yeah, so treatment as prevention become a very important issue. If the people living with HIV, they got treatment, they can reduce 96% of transmission. Yeah, and and the study, partner study, have shown, yeah, the result is promising. You see zero transmission, which means if their partner, HIV partner, under treatment, and no one transmit by their partner. So that is very important. And also for the pregnant woman, we have very successful successful contribution. In Taiwan, we achieved zero transmission, mother-to-child transmission. So you will see if a positive person have heart and the negative person have PrEP. And then, yeah, you're just okay. So I just want to end off here. Yeah, the PrEP and the early treatment, undetectable equal to untransmittable. But don't forget condom. And we are going to end of HIV. Thank you for your attention.
Okay, thank you very much, Professor Monica, that delivered very benefits and interesting topic today for our knowledge, for all of us as a participant here. And as you mentioned before, that I think this is being the global goals for zero new infection, zero discrimination, and also zero AIDS-related death. And it is very excited to see that Taiwan can reach zero new infection. And also some of program that you did in Taiwan to achieve that, for how to improve their awareness of their status and giving the properly treatment and early treatment. I think it is very important for us in doing treatment for HIV people. And also advocate PrEP, maybe it's also quite unfamiliar for us how to give PrEP for people in for people negative HIV. Maybe it's not familiar for them to take it. Maybe only how to use condom or others things that they can do. So maybe some of participants already has question for Professor Ko. So we move to discussion section. So I will allow you for all participants, ladies and gentlemen, to ask directly, and committee will unmute your voice, or maybe you can write down in a chat box. We will have around 15 minutes for discussion.
Okay.
So,
yeah.
Okay, so please, participant, you can raise your hand. Okay, so we have Chichi. Maybe the committee, you can help to unmute Chichi.
Okay. Can you hear my voice, nurse?
Yes, I can.
Okay, thank you. Well, my name is Junza. I'm student of Institute Technology of Health and Science via Fakultas Samarinda. Well, my question is about PrEP itself. The PrEP, there is any contradiction for someone who consuming the PrEP itself, or if someone who want to consuming the PrEP, they should do the medical checkup or not? Thank you. That is my question.
Okay, thank you very much, Chichi. The question from Chichi about PrEP medication, Professor, maybe in the beginning, should they do medical check or not?
Yeah, sure. They have to check up their HIV status. But we also, because some acute infection stage probably we miss up. So we have using PCR or using viral, and we are very aware to see do they have a risky behavior before they're taking PrEP. So we must to confirm they are HIV negative, and then we can prescribe the PrEP to them. And then 1 week and 1 week after, or 1 month after, they have to go back to double check their HIV status to make sure they still HIV negative. Yeah, yes, we have.
Okay, thank you, Professor. So we have to do medical checkup first to make sure that she is negative HIV, and of course we also have to do monitoring for during giving PrEP, right, Professor? So other question, we are still waiting for other question. We still have several times. I see in a chat box there is a question, Professor, from, I think this is the student from Taiwan, maybe, Professor.
Yes. I saw, yes, all the PrEP still, I remember that is not available. They're only available in Taiwan and in Hong Kong, but not still available in Japan or Korea. They are still on the way because, they change a lot of value and belief system. Yeah, so they're still on the way. But because I am the policy influencer, so we work on the issue very early, as I mentioned, 2010. Yeah, and then we can succeed in 2016. Yeah, so in some country like I know in Vietnam they already have that. In Philippines they are talking about that, but in the black market that some people can buy PrEP on the black market. But I don't think that is safe way to do that. So that's why that I think we need to put the power on people's hand, especially people really need that. Yeah, I always said that, we have many sugar drink, right? But why not we provide PrEP to people really need them? Yeah. If all the scientific study already prove PrEP work and effective, how come we're using some discrimination, or the way we stigmatize people living with people who are sexual minority, or don't give them that weapon. It is unethical. I would say it's not ethical. Yeah. So we're still working on different partners in different countries to make it possible. That in Indonesia is still not common. Yeah, so I'm working with my students. I wish, yeah, some people really need PrEP can access and also can take PrEP to prevent them from HIV infection in the very near future. Thank you.
Okay, thank you, Professor. So PrEP is still available in Taiwan and also Hong Kong, right, Professor? And still, we're still waiting for other country.
Yeah.
We still have one participant who Hello, Ms. Sumiati Sinaga.
Okay. Yeah. I can answer the question from Luciana. Yeah, about we want to act about PrEP. How if we want to stop taking PrEP? Is there any negative impact? Actually, if you want to stop taking PrEP, that'll be okay. I think the reason why you need to take PrEP because you have the risk of infected with HIV. If you are not on the risk, you can stop. Yeah, that is no question. Yeah, and in terms of long-term side effect, yes, PrEP, the Truvada, yeah, they do have some long-term effects. So they changed to the PrEP 2.0. So they are going to have another version of PrEP. So in Taiwan, like this year, we are going to have PrEP 2.0, another version. And then they will significantly decrease the side effect and also decrease the long-term side effect. Okay. Yeah. Okay. Yeah, that is my answer.
Okay.
You're welcome.
Okay. Thank you, Prof. Monica. Is it my time to ask, Miss?
Yes, Miss Sumiati Sinaga, you can ask directly to Professor Ko.
Yeah. Okay. Thank you, Prof. This is interesting topic about HIV. So when we talk about the strategy to prevent HIV, or maybe to prevent the increasing of positive case, we talk about one strategy is education. So as we know that education is almost maybe I say every time we do or we educate our community about HIV, how about the transmission and how about the transmission? But we know that even we have do or we try to educate, we can see that HIV still happen in around us. So can you share your experience about how or what kind of strategy in providing appropriate or interesting education as prevention to in it's HIV. So I ask you about the effective education. And one more question, speak about a stigma. It's also not easy for someone who is infected of HIV to tell the truth about their condition. I mean, to tell to people around them to say that I'm HIV person. It's not easy. It could be because they are afraid of being stigma, or they may be excluded from their community. Whereas when they are dishonest, or they are not honest to, or try to cover up, it's very possible that transmission can occur. So can you share again about your experience with us about how to make someone who is already infected with HIV to be honest with the people around them? Thank you. I have two questions.
Okay, thank you.
Serious? Yes.
Yeah.
Okay.
Okay. Yeah. As you see on the screen, that is a documentary film. I'm also the producer. I work with the director and then produce a film we call The Love of Hope. The Hope of Love, sorry. Yeah, and because of the time issue, I didn't share with you. And I think using the real story, the real person, and to share their experience, and then will bring a new idea of how people with living with HIV look like. And then because that is a real person, and their story will touch the heart of the audience. Yeah, so that is very important. But the social environment also important. If the social environment is still stigmatized and have hostile, have a question about people living with HIV, they won't stand out. Yes, or they won't speak up. Yeah, so recently, like I deal with, there is a fire case. They file about the cardiac surgeon refused to operate surgery for a person, people living with HIV. And then we have a channel. So he filed up the case to the our committee, and the final result, we rule it as a discrimination. And then we find the hospital, not the surgeon. Yeah, because that is the system issue, not a personal issue. Yeah, so you have had the channel had a law to protect their right. Yeah, that is important. Yeah. And how do we have the positive environment? I think we not only as people living with HIV, they need to be brave and they need to be speak out. No, we need to educate our person, how community work with and to help people living with HIV, how healthcare system provide friendly care, and how about the school, how about the long-term care. Yeah, it's still a long way to go. Thank you. Yeah, that's my answer.
Okay, yes, thank you. So this is the hard, I think we have to always try to make a strategy or to implement the strategy, right?
Yeah.
Okay, yes. Thank you,
Yes.
thank you, Prof.
I think
Welcome
so,
to
Professor.
NCKU. Yeah, you know, NCKU hospital is the best of the best. Yeah, in HIV care. And all in Asia that are well known. So welcome to visit us.
Okay.
Or become our student. Welcome.
Okay, thank you very much. Maybe we will do that program, Professor, to see in a real condition what kind of things and programs successfully by NCKU to prevent HIV. And it is very interesting because it is like a film, Professor, film or a movie. that maybe
it's
not
a
only use
documentary.
conventional education, but we can touch them by movie or films that they will interest about that and they will learn by the content of the movie, right? It is very interesting.
And we always say a story is very powerful. Yeah, they can touch, they can influence person's idea and break through their stereotype. Yeah, so in around 15 years ago, we had many people living with HIV has been trained and supervised, and they walk into the classroom to share their story. Not only for the hospital, they walk to the junior high, medium high, and to share their story and really make difference.
Okay, so we move to next question. I think this is the last question because we don't have much time for discussion. I'm so sorry, participant. And this is the final question. But Luciana, I think, Luciana, your question already answered by Professor Ko, right?
Yeah. Yes.
So maybe one more question. If you want to ask directly, you can raise your hand and you can ask directly to Professor Ko, to all participants. Ladies and gentlemen, we invite you to ask directly to Professor Ko. One more question. Is there one question? Okay, one more question. For Mbak Vanessa, time is yours. You can open your mic.
Okay, thank you for your time. I'm Vanessa Puran from Institute Technology, Science Creator Sada Samaria. Like a professor, I want to ask the professor, we have to choose. We can choose with condom or with PrEP. How you can give me one person's the safety of the condom to reduce the transmission in the HIV? How one person's from the condom touch? One person, we can choose two choice. Choose one. We can transmission HIV with condoms, and we can use PrEP. What?
Okay.
Yeah. What person? What person? If we can use condoms, one person. Condom that reduce the transmission of HIV touch. One person.
Okay. Yeah, I can answer your question. Actually, no matter they're using PrEP or not, we always encourage them using condom. Always. Yeah. But you know, sometimes yes, like one night you just met people you like, but you don't have condom on hand, and then that would be a trouble. Yeah, so we have PEP, post-exposure prophylaxis. You can have PEP, and for people who continuing conducting risk behavior, for example, that had been diagnosed with STI, sexually transmitted infection, or they're using additional drug, addictive drug like the methamphetamine, ketamine, or MDMA. Those people, we are strongly encourage them start using PrEP and also using condom. Yeah, so we have different criteria, but all people, we all encourage them using condom. And PrEP is especially add-on for those people who had risk. Yeah, that is my answer.
Thank you.
Okay, thank you very much, Professor. So it's mean maybe both of those kind of thing they have to do together, Professor. I mean,
Yeah, sure.
not only condom, they also consume PrEP if they know that they are in a risk condition, right?
Yes, yes. Mm.
Okay, so thank you very much for Professor Monica. They already give us very benefits and very great knowledge for all of us. I'm so sorry because we don't have much time for this section. So I will conclude this section that Professor Ko mentioned. We have several programs to reduce the number of new HIV infection, how to reach the goals for zero new infection and zero discrimination and zero AIDS related to death. We have to improve their awareness of their status and also how we can give early treatment and properly treatment for people living with HIV and discussion about PrEP also. So not only people who living with HIV, but also people who has risk for HIV infection. We also have considered with that. And doing tests more is very important to reduce the number of HIV. And the important thing also how to advocate and how to give education for our society to prevent HIV and stay safe from HIV infection. So thank you very much for Professor Ko that
Terima kasih.
Oh, you can speak Indonesian. So I also will speak in Taiwanese.
谢谢。
谢谢. Oh yeah. 谢谢. 谢谢你, Professor.
Yeah, thank you.
Thank you very much, especially for NCKU, also for institution here.
Okay.
And also thank you very much for all committee in NCKU.
Thank you.
So maybe there is a disturbance in connection, Professor.
Yeah, it's okay. Yeah, okay. So do we end of this section?
I think so, but maybe they will want you to have this certificate recognition. And
okay, I'm so sorry, Professor, because there is some problem. Okay. There is some problem with our connection. So thank you very much for Professor Ko Naying as our main speaker in this section. So this is our appreciation, and we also very glad to collaborate with NCKU. And we hope that there will many benefits program between us, between NCKU and also ITEKES WHS. Thank you very much, Professor Ko Naying.
Yeah, thank you. Okay.
Thank you, Professor.
Okay, so the time is up for this section. Thank you for all participants that joining in this discussion also. And I will give back the time to Master of Ceremony. Thank you very much, and Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Prof. Ko and Ms. Ririn.
Okay, thank you to our speaker for today for the information and knowledge which have been given to us. May it be useful for us, and thank you so much to our moderator today, Nurse Wahyu Dewi Sulistiarini, Bachelor of Nursing, Master of Science from Lecture, Institute Health of Technology and Science Wiata Usada Samra. And thank you so much, Professor Konaying, Register of Nursing, PhD from National Cheng Kung University, is Information and Knowledge today. Thank you so much, Prof.
Yeah, okay. Now we move to next session. It's a session 2 with our guest speaker from Faculty of Nursing Andalas University, Nurse Mahathir, Magister of Nursing and Specialism of Community of Nursing, with the topic Breaking the Stigma and Empower Self-Testing for Key Population. So we will guide with the moderator, Miss Cici Hairunisa. Can you hear my voice? Hello? Okay. For Miss Cici Hairunisa, time is yours.
Webinar HIV and AIDS. So, well, before we start our discussion or our webinar, let me to introduce myself. My name is Johanesa. I'm a student of Institute Technology and Science Wiata Husada Samarinda, who will moderate. Well, I'm happy to see you in this session, even though we meet in room Zoom. By this session, the theme of this session is talk about empowering self-testing to upscale HIV test and downstream the stigma. It will bring by Nurse Mahathir, Magister of Nursing, Specialist of Community of Nurses. Before we start these sessions, let me to read the backgrounds or creativity of our speaker. So, the name of our speaker is Nurse Mahathir. He was born in Padang in April 15 in 1988. Well, about education background. He took for in 2003 till 2008. He took a nursing faculty under University for bachelor degree. In 2011 till 2012, he took for the nurse professions program. And then in 2013 till 2015, master degree program University of Indonesia. And in 2015 till 2016, community nursing specialist program University of Indonesia. Well, for the training, seminar, and conference in internationals, we take international recruitment IV8 seminar, basic knowledge at Padang, Indonesia, and the International Nursing Conference, basic knowledge in University Indonesia, Jakarta, and then Andalas International Nursing Conference or Nursing Conference in University Andalas, Padang, Indonesia. Well, for the publications, is the first is the experience of PLWHA in healthcare utilizations at DKI Jakarta, the implementation of Hello TB intervention in change, the quality of life among adults affected with tuberculosis in 2016 in Jakarta, Indonesia, and then the effectivity of classroom simulation method in family nursing learning practice to nursing student family focused care competition in AFNI, Indonesia, and then it will stress me out in the result become positive, a qualitative study of people living with HIV performed delay test in Jakarta, in Padang, Indonesia. For the research test in 2016, the correlations of self-management of hemodialysis compliance in chronic disease and then experience of mother living HIV, the implementations of HALAU, TB interventions, and then the effectivity classroom simulation, and then the effectivity of target group interventions and in change medication and complements, and quality of life tuberculosis patients. Well, hello, Nurse Martina.
Hello,
Can you
but
hear my voice?
yes,
Okay.
I can.
How are you? How are you, nurse?
Yeah, I'm great. How are you, Mbak Cici?
Wow, I'm really amazing. So really amazing. Well, nice to meet you, sir. Well, before we start our sessions, let me to explain the rules of our discussion.
Yeah,
So
sure.
you have, okay, so you have 30 minutes to presentations. After that, we have 15 minutes to Q&A session. Okay, nurse?
Yeah, but I need you to remind me if I am getting to lose the time, and then maybe you can just uh, take a break and then send me a reminder. Thank you. 5 minutes before.
Okay, thank you so much. So you can start your presentations.
Okay, thank you, Mbak Cici. So maybe I want some help from the committee to present my PowerPoint, or maybe it could be just me to share the PowerPoint presentation.
Okay, sir. Our committee will invite you to share your
Or maybe I can,
PowerPoint.
Mbak Cici, if I can do it if you are busy with anything. Have anyone see the slide? Yeah,
Yes,
I think.
sir.
Yeah. Okay. Thank you very much, Mbak Cici, for delivering the session to me. It is really glad for me, Mahathir, from Faculty of Nursing Universitas Andalas. It is an honor to me to be here to meet all of you all in this interesting topic of international webinar about HIV. I would like to say thanks to and welcome to and greetings to the all of the Kita Keswiata institution board, and then the students, and also Professor Ko and the NCKU student university. It is really an honor for me to discuss with you all in this virtual meeting. For today's topic, I would like to discuss about the empowering self-testing to upscale the HIV test and downstream the stigma. There are some key messages here that I would like to say to all of you. The situation that we have in here, that we face the iceberg situation under the stigma in the country. I'm sorry for the mistyping. It's not an iceberg breaking, but iceberg situation. We all really realize then, and also we all really know about the situation that we face together about HIV. The people living with HIV is really hard to live in here because of the stigma. The rising of the right-wing political system, the people really like to judge everyone. The people likes um, to push anyone that they have as that they have a sin, and then they have a mistaken behavior that lead to the HIV. They really believe now that the HIV is impact for the sinner. So the raising up of the right wing political perspective, it really leads to the increasing of the stigma itself. In previous decade, we are really concerned about the stigma itself, but we don't realize that we stop that immediately. I mean, like slowly but sure, we don't really care about stigma anymore. So the people living with HIV and also the key population is really being detrimental by the situation. And then they feel afraid to go to the healthcare system, to the healthcare service to only check their status. Actually, if there is no stigma, people just like the other disease. If we compare, if people are feeling sick, they going to the healthcare services like public health centers and then hospitals to check their medical condition. But for people living with HIV or a key population, they must be feel afraid because of their behaviors that they have been done, and then they also afraid to be exposed by the people about their behaviors, and then their labels. So it makes the data that we are really gather right now is not really a real data, I think, because of the people is just behind the water, the iceberg situation. Maybe if you have some friends, some of college, and they have pretty much risky behaviors, but they don't really want to get to know of their status, and then they choose to be quiet and then shut, and then they may be just waiting for the disease is getting in upscale stage. So this is the situation that we have to face, or number that we have to be concerned for all of us in this afternoon session. And the second one, the current strategies is lag behind. We all have been watched. We all have been heard the Professor Ko talking about anything related to prevention strategies. It is really so many varieties in Taiwan context that they can implement it. But in here we have so many lack of options. So the current strategies is not really keep up with the international scale and updates. For example, we don't have PrEP in here, so some people have to access it through black market, and then it's not really safe for them to take a medication that really need a prescription and then medical assessment to join the right. And then the U equals U that Prof. Ko also mentioned before. It is really need to campaign the U equals U. Undetectable means untransmittable. It is really not well known in here, the campaign about that kind of things, because people think if people living with HIV, it must be very infectious. But if they do a proper medication and then compliance with the therapeutic recommendation, it would be makes them undetectable, and undetectable means untransmittable. For the people living with HIV who are in the viral suppressed status, it will be less infectious to others. So this is really important for the prevention strategies. And then in Indonesia, we still don't have that kind of campaign. And also for the key population, it's not really well maintained by the activists, by the government to put all the strategies into their needs. So people-centered care is not really happen here. So this is a really bad situation for us to achieve the HIV progress. And then the cases must be getting worse if we don't act now, and then we don't really have give so many attention to the situation. And the third one, the key messages for this afternoon session, the HIV-ST is one of prospective choice. There are so many preventive prevention strategies that we could implement to the population, the key population, and also general population. The trend is slow but sure. It's getting wider, but the action is really limited. And in that type of strategies, we have another option, HIV self-testing. This is a kind of prospective choice that we can use, but it is also not really well implemented in Indonesia because we have lack of policy support, and then we don't have financial stability in implementing this type of strategies. HIV self-testing, it will be matched with the situation, the current situation that we have faced together in here, because the stigma is really high and the people is afraid to go to the healthcare centers to for only just check their own status, because it is their right to know their HIV status. And then the last one, the implementing in local context is important. We all realize that the financial is not being provided by the government. The policy is not really there to implement this type of strategies, but we can do this type of strategy to be implemented in the community. Maybe we can try to find the financial support by joining the grant scheme, and then the and also academician is really have an open opportunity to use their opportunity in research, in community outreach, to pick some financial support to implement this type of strategy. So we could have the key population to be more safe, to be more accessible with the zero status checking. Now, with that key message, we also realized that the achievement of 2020 mission of the UNAIDS is really have so many progress, and it is quite an happy news, but it's not as passionate as we want. Yeah, we want 90% of people are being diagnosed, and then 90% people who are stated as positive in HIV getting on treatment, and then 90% people living with HIV are on the medication of antiretroviral is virally suppressed. But in 2020, the progress is not really there. The progress is good, but not as what we want. We want 90%, but in 2020, we only have 84% of people living with HIV knew their HIV status, and it is still much more to try to raise the achievable goals that we want in 2023. And then among people who knew their status, 87% of them were accessing treatment. And then among people accessing treatment, 90% were virally suppressed. Of all people living with HIV, 84% knew their status, 70% were accessing treatment, and 66% were virally suppressed in 2020. So this message is the effort is not be stopped right now, because of we have to put up much more efforts to achieve the goals, and this is everyone's task, and then it is everyone's responsibility to help and to achieve the global goals. Even though it would be new barriers for us right now, for the activists, for the government, for the researchers, for everyone to tackle the HIV. We have now COVID-19, and it is really make these HIV sectors also getting decreased by the situation. It is not really good enough to have prevention strategies late in 2020s because of the COVID-19 pandemic. Everything is stopped. People cannot access the prevention strategy. They only learn on by themselves to prevent. So if the situations keep coming, and then we don't make sure the prevention strategies is being implemented there, it will be give us the catastrophic cost later in the next years. So it is important that the achievement of the goals is really quite much a good news for us, but it still have to be more give some more efforts to achieve the exact goals that we want together, right? And then also in 2020 we want 90 strategies. 90% of people are being diagnosed, 90% of people living with HIV are under treatment, and then 90% of 90% of people living with HIV who consume the medical treatment antiretroviral are virally suppressed. But in global targets 20 and 25, we are putting people living with HIV and community at risk at the center. So we are getting shaped to the exact goals, to fulfilling the needs of the communities at risk or a key population. And this is a good news for us. Because of this target, it will open our chances to bring some more prevention strategies, treatment strategies, and also follow-up strategies for the other diseases related to HIV and AIDS. So it means that the key population, it will be the center of care, the focus of the action. So they will be involved so much, and then they will be fulfilling their needs based on their characteristic and then their unique identities in each key population. And then also the passionate global targets of 2025, it will bring more goals for us. It start with 90% and now we come up with a 95%. The 95% of people in communities at risk with HIV infection must be used combination of prevention. Professor Ko told before at the previous time about the prevention strategy that being implemented in Taiwan, and there are so many options for the communities to reach these prevention strategies. But in here, and then also heard about discussion, do we have to combine condom and trap together to get more barriers to people with risk to get infected by the HIV? Yes, because this is our focus right now. Until 2025, we have to focus on the combination of the prevention. So we have to do the condom prevention, we have to do PrEP strategies maybe, and then we have to do another device or barriers that could prevent HIV. For example, the upscale testing, and then the treatment options, and then anything that we can choose, male circumcision, and then also the medication improvement and anything. So we need to keep up the step to get some more option for the people to reach the prevention strategies. And then 95% of people living with HIV know their HIV status. So it is not it is not enough for us to achieve 90%. So we need 5% more to maximize the goals. And then also in 2025, we are really wish for people living with HIV who knows their status initiate treatment. Treatment is really important for the people living with HIV because of the compliance treatment, the medication treatment, the easy access treatment, free stigma treatment. It will make them it will lead them to viral suppressed condition. It is important for us for the prevention itself. If the people living with HIV consume their medication properly, and then with compliance, it will make them in undetectable status. Undetectable status, like Professor Cole said before, it means untransmittable. So they less transmittable for the people. So it is okay for people living with HIV to have sex with another person as long as they have their medication and then use condom. So you don't have to be afraid to have spouse with the HIV status. So they are just like people, human being that you could treat the same with the other people, normal people without HIV. And then 95% on treatment are virally suppressed. Yeah? And then 95% coverage of services for eliminating vertical transmission. So this is also important for the HIV testing, the coverage of services. So we have to be more accessible for the people who at risk with the HIV. And then by managing this type of strategies, it will reach much more of them. And then they will be notified by their own status, and then they have to make some important step about their health status. And then 95% of women access HIV and sexual and reproductive health services. Women now are impacted by the global HIV situation, and then it needs to pay more attention to theirs. And then availability is important, so does acceptability. We all now realize that HIV testing service in Indonesia is quite much a progress. The progress is really good. We can find in the cities, for mostly, we can access the HIV testing service in public health centers. It's only like by using public transportation, you can check your status. You have to give so many efforts to reach the available HIV testing services. But availability exactly is not enough for them. Without acceptability will cause poor coverage. Yeah, even though we have so many HIV testing services, but we have still the iceberg situation. The people think because of the acceptability for them, because they think the HIV testing services is really unfriendly services. They are not really comfortable with the services. So it means make them fear of stigma and discrimination. So they choose to be quiet. They choose to be waiting to wait their own status. Like in my experience, I have also a friend who is still younger. His age is around about 30 or 31, but because of HIV, because of AIDS condition that he have, because of the risky behavior that they have, that he did before, it makes him get infected by the HIV, and then it's getting known in later stage, in AIDS stage 4 or late stage. So we cannot help him anymore, and then he died. It is really sad situation that we have to face, that our youngers, our future generation, our human resources is getting to be dead because of they don't want to check their own status, but they are realized that they have the risky behavior, the risk situation that might them to get infected by the HIV, and then because of the fear of stigma and then punitive laws and practice that criminalize behaviors, it makes them to just waiting what will happen to their body, and then at the end we cannot help them anymore. So they become died. People are not numbers. People died is somebody's husband. People died is somebody's son. People died as somebody's sisters and others. So this is really important that we have to count everyone to free from HIV itself, and thereby discourage access to health services, including HIV testing service. It makes the poor coverage of HIV testing service in reach out the communities at risk and key population. And I want to say, and I also want to share to all of you in this academic gathering about my qualitative research among men who have sex with men. In my recent studies, they feel that the lack of option of the prevention strategies, they only think the prevention strategies is only a condom and lubricants, but it's also not easily to be accessed by them. They have to pay for that. They feel embarrassed to buy a condom to the convenience store, and then they have to do some a role play and then acting gesture to get some condoms. So this is really bad situation for them. They not really easily access to a condom services. So it makes them vulnerable to get infected by this disease. And we also realize that they have they are the population that really easy to conducting sex consensus in immediate situation by using an application. And then sometimes they just don't realize the condomless sexual activities is really not safe for them because of the lack of information. They don't access the information because of the pandemic. They don't really much have health education to the communities, and then they don't gather anymore with the peers that talking about the prevention strategies of HIV. But we all know that in international or global update, the prevention option is really so many options, but in here they are lack of option. And then low acceptability. The people at the MSM in Padang context at my place, it really do not feel safe if it comes to the public health services to test their HIV status because of their fear being recognized by the people, and then they also fear of the stigma and discrimination. They also fear about the confidentiality because I also hear from them the healthcare professional itself sometimes talking too much about them. If they come to the services, they gossiping about them, they talking about their status to another person that who didn't have the rights to know their condition. So it makes them do not trust the health testing services. So they sometimes it is dangerous for them to check their own status. And then superficial connection. They feel that the MSM, when they're visiting, they was visiting the services, it makes them just like say hi conversation, but they really needs more. They need to be explained about the HIV. They need to be explained about the prevention strategies. But when they test their status, they only told them about their result, positive or negative, and then that's all. There is no follow-up counseling. There are no another prevention strategies if they happen to be negative, or if they happen to be positive, they just give the explanation about the medication and then nothing more about that. So it is really a superficial connection that they feel, and it makes them feel uncomfortable and then feel not being accepted by the health services, and then it makes them afraid to come for another more to test their status and then to think about the prevention action that they should have doing. And then also not people-centered approach. Yeah, they give health intervention to the population is not really based on their needs. They just make them global and then superficial. It makes them their needs of information and they needs to be understand about HIV. It's really lack, and then it makes them more vulnerable to get infected by the HIV. And then I am also afraid about the outbreak situation in this type of population. Another strategy is needed to better support and complement existing HTS or HIV testing service approaches in order to reach people who may not otherwise test, integrated into existing community-based and facility-based HIV test services, approaches, and tailored to specific population group need to be provided. We have to think more. We have to give them another option. Because of the situation, we need to act more people-centered care by their needs. So HIV self-testing is quite a strategy to answer that question. So HIV-ST is really a viable option to use in the high density stigma of the population. We have realized that stigma in here is really, really high for the people living, for the key population. For example, for the sex workers, for the injecting drug users, and then for the men who have sex with men. So they are not safe in here. They are being judgmental by the people, being discriminated by the people. So the HIV self-testing, it will make some space for them, safe space to get to know their status, but in proper manner and based on their needs. So this HIV-ST strategies is really important to be implemented. HIV self-testing is one of the choice. HIV-ST specifically refers to a process in which a person collects his or her own specimen, oral fluid or blood. There are so many devices that can be reached by them, but it's only in online version in black market. Sometimes it's not really well known for them to access that. And also it's not the quality and the recommendation of the testing kit is not certified by the authority. So in this, so the situation itself needs to be arranged carefully, and then it's more be organized by the activism in HIV and AIDS. Even though the financial support and policy support is not really there, but in local context, we can implement it in by make sure the testing kit that we have to provide is certified and then also qualified for them to use. And then they perform a test, interprets. The population will perform a test and interprets the result, often in private setting, in their home, in their local space, and then in their community space. So it's free for everybody to do some tests. It's like a blood glucose test. You can use that. Maybe the student here have already used the blood glucose test, self-test. You can check your own blood glucose. So also in HIV, you can also test your own HIV status by using this device or kits. Either one or...
Sorry, nurse, you have 5 minutes.
Sudah habis. Wow, masih banyak.
You have 5 minutes for your presentation.
Okay, thank you, Mbak Cici. Yes. Okay, I have to keep faster because I don't have really much time. Now, the HIV-ST is only a trial set. It's not definitive. It's only make them realize their own status and then engage with the actual health testing services. So if you want to make sure this type of strategy is being implemented to the population, so we will provide this test kit, and then we have to give them some information about how to use it, and then do some communication from far away, like by technological using, by using WhatsApp messengers, websites, or application that can be used to get connected with them. So after that, they will perform their self-testing kits, and then they have the result, and then they have to report back to the trained staff or to the nurse, or to the counselors, to the doctors, or to the healthcare professional that being provided the kits for them. So if the result is reactive or positive, so they have to retest by using the more sensitive test in the public health centers or hospitals, and then if negative, they have also to retest if they have the high risk behavior that we could really predicted the maybe it might be there are false negative in there, so they have to retest, and then if the test is really there, and we have to recommend to use to repeat the test in another time, and then they have to get some more information about the prevention strategies to make them stay negative and then free from the virus. And then after that, after the TSAs, the useful links must be provided by the HIV testing services. We have to provide them with information about what is the positive means, and then what do they have to do. And then if the result is negative, so they have to repeat the test again in another time, or with more sensitive and specific another type of test, and then they have to be well informed about the prevention strategies. It can be used by using technology. Technology is here. Everyone have their smartphone. They have internet connection. So it's really easy to implement these type of things, but it's really it is put upon concern about the financial providence. So this is the systematic review. Maybe because of I don't have much time. Types of HIV/ST is directly assisted HIV/ST. So we can observe them beside or from far away by using technology also. And also there is a type unassisted HIV/ST, refers to when individuals self-test for HIV and only use an HIV/ST kit with manufacturer provided instruction for use. Both directly assisted HIV and unassisted, you can also do it. May supply additional support tools such as telephone hotlines, mobile phone text messages. It really needs it's really easy, and it really needs only your own smartphone, and then quite up of technologies, so you can do it. This is case example, an internet-based HIV self-testing strategy in Padang that led by me. I am trying to put some context to propose a proposal about community outreach, and then I am trying to provide the testing kits, and then I am me and the provider give the essential information about how to reach the self-testing kits, and then they have to do telecounseling with me and with another health professionals about the preparation to do the HIV self-testing, and then they have to watch some videos about how to do and how to use the self-testing kits of HIV. Now, the program to increase HIV testing and linkage to care among men who have sex with men. My program is specifically for men who have sex with men because the budget is really tight, and then I have only several kits to be shared. So the program uses internet form to other men who have sex with men, free self-testing kits, and then video tutorial that I said before. And then by doing this, potential barriers. This is there is the risk of violence, maybe. I am so full with hate speech sometimes by the population itself. Sometimes it's not really comfortable, but they dub about the program, and then they feel insecure about the program itself. So the potential barriers that you have when implementing this type of strategies is risk of violence, self-harm or suicide, and then misuse of HIV/SD kits. Some people is getting wrong to use the device, and then it makes the result is not really there, and then it makes us give them another more self-test kits. So it's quite a potential barriers if we don't really maintain them with sufficient information. And then lack of support and potentially high costs. So if we going to continue this program, if the government is not really there to support us, but it will make the cost to provide this service is quite expensive. So it needs to be more support, more support for them, obviously. Thank you. I will handing over the session to Mbak Cici. Thank you, Mbak Cici, for the question and answer session.
Okay, thank you so much, Nurse Mahathir, for your presentation. And then when it comes to the Q&A sessions, well, for the Q&A session, we have about 2 minutes to have a Q&A. Well, to therefore all of the participants who want to ask a question to our speaker, Ms. Mahathir, please you can raise hands and or you could like to mention your question on the chat box. Please, who want to ask, I will give you permissions. Oh, well, we have one question in the chat box. For introducing, well, this is come from Grace Ophelia from IPK Sudiarta Husada Samarinda. Well, the question is whether all the methods that have been tried are effective in eliminating HIV/AIDS, and along with the development of technology, is there a new way that is more effective to avoid? Well, Ms. Mahathir.
Okay, thank you, Mbak Cici, and also thank you for Mbak Grace Ophelia Sunda that has been questioning about this type of strategies. Yeah, maybe I should repeat the question because I'm not really heard. I don't know, maybe the technical problems. So I would like to repeat. But Grace asked me about whether all the methods that have been tried and effective in eliminating HIV and AIDS, and along with the development of technology, is there any way that is more effective to apply it? Actually, I would like to remind us for once more, the activism in HIV sometimes is quite decreased right now. Everyone is changing their attention to another sectors, and then the financial also get impacted by the COVID-19 situation. So every financial support, policy support is taken by the COVID-19. So it makes for now the situation is quite blurred. So people kind of forget of the achievement that we have to achieve in 2025 later about the goals. And then the first one, we have to get back on track, Mbak Grace. The effective strategy to implement HIV self-testing, it's only by trying it into a real situation. Actually, the technologies is the best way to deliver the type of strategies, because we don't have really much option to do it more effectively, because face-to-face meeting is quite risky for them. As I mentioned by my research, they're really afraid to get contact with the providers because of the situation that they felt. And then technology, it give us some free space, and then also confidentiality space. So they can, in my experience, when they talk to me from far away, they feel can talk to me about anything. The sexual experience, the risk behavior that they have, and then also the curiosity that they have about their own status. And then also, when we provide this test, it's depend on the health professional that give the information and the counseling to them. If they feel comfortable, it's really easy for us to deliver the testing kits, and then it's really easy for us to reach them, to get their attention to do some testing, because it's really hard to ask them to do something like that in nowadays. I mean, like when they are in the perfect condition, the acute infection is just there. It's not really, they have not really opportunistic syndrome to be aware of, because of sometimes they come to the providers is only because of they have symptoms like, for example, candidiasis, persistent diarrhea, and then any other symptoms. So it will be late for us to maintain the spread. So with this technology, so they can tell anything. They can WhatsApp you anytime they want. If they experience curiosity, they just text you back, and then we can answer it back if we have spare time. And then it's really effective to implement this type of strategy, Mbak Grace. Thank you, Mbak Grace. I think it would be answer your question. Mbak Cici.
Cici?
Oh, okay. Okay, thank you so much, Mr. Mahathir, for your answer. Yes, that is your answer from Mr. Mahathir is come with how we could to buy the technology first. That is, the technology is always improving year by year. So we could, in this pandemic, actually, we could do the testing by technology like in the site of
Yes.
Nurse Mahathir that says HIV self-testing, right?
Yes.
Okay. Well, thank you, Grace. Next questions. Please, for all of the participants who want to ask Nurse Mahathir directly, you could like to raise hands, and then I will give you permissions to. Okay, this comes from Nurse Sumiati Sinaga, that is our lecturer. So, hello, Nurse Sumiati Sinaga. Okay, you could.
Okay, thank you.
Yeah, Mbak Sumiati.
Nice to meet you, Mr. Mahathir.
Yeah, me too, Mbak Sumiati. I hope you well there.
You look so young.
Yeah, I am young. I'm only 27 years old.
Oh, like me. I am 70 years old too. Yes.
Okay.
Okay, thank you. This the interesting topic. Talk about HIV ST, right?
Yes.
In my opinion, doing the test by yourself or ourselves, and then we know the result is not an easy thing, right?
Yes.
Is it hard? I think when we know that, oh, I'm infected by HIV, I think it's not an easy thing. When a person find out that he is positive or she is positive, he or she may be shocked and do dangerous things, such as hurting himself or maybe ending his life. So can you explain what kind of counseling that we can given to anticipate this incident. I mean, not just educating them or not just education, but the specific counseling to them before they do the test. Or maybe you can share to us, there is a procedure uh, in place to do the counseling before or after the test. Is there a procedure like that? I hope you can share with us.
Yes.
And what is the specific role of us as a nurse to provide the appropriate counseling? So not just educate, right? So that is my question. Thank you.
Yeah, okay, Mbak Sumiati. It's really a great question. And it's really imagine how it would be if we do this type of strategy. As you concern, it is really happen when I am implementing this type of strategy, HIV/ST. As you know, it is really not easy for people to get to know their status only by them, and then there is no people around them. When they there are so many expression from them, but if you really there, if you make the pre-counseling and then the information is really sufficient from that for them, actually it makes us just like a usual provider. We are doing like briefing session. Yeah, there are so many people when know their status is it. Sometimes most of them are really shocked, and then we have to make sure to them when the HIV result test is being notified by them, and then the situation is not really as expected. The mutual relationship that we have built before is it's really important. It's really important because of when we take their trust to us, their what do we call their deepened relationship. Because Sumeti, when we did this, if we do pre-counseling with open-minded and then with C, 5C that recommended by the WHO, confidentiality, and then the 5 C's, yeah. I forgot which one of the C's, but if we maintain the relationship between us with them in the pre-counseling test before they take a test, so it will be make more much more easier to us to give responses to them, because it's not really easy. Yeah, it's not really easy. I said to you, it's not really easy to respond with this situation. It needs times. For example, it's just not like one conversation. They keep calling me and then keep talking about it and then repeat it again, and then what do they do? And then I keep just calming them. So the important one is we have to give them the information about the HIV is not something that we scared about anymore, because we have the medication right now, and then the medication is also developing, because so many research that are now talking about yeah, Prof. Ko also mentioned before, yeah, the type of medication that we can use just once in a month. So we wish that the drug platform can be used widely in later years. So the important one is, as the provider, we have to be calm first, because they keep asking you, they keep terroring you with messages, and then with telephone, and then asking you about what will happen to their in the future years because of the HIV will make them die. They have to they think about how about I end this life. It's also happened to them, but Sumiati. But the things, the uniqueness of being a counselor is we have to learn about the situation and then act based on the people needs. So the competency is not really easy. So you need to be practice more. You have to get to know more about the counseling. Counseling is not just deliver the information, not that all. We have to learn about the expression. We have to assess about the objectivity. We have to assess about the needs of the population that need sufficient information about their wrong perspective. So I said it is really easy. Of course not, because when I am discussed with the public health centers providers, the VCT voluntary counseling test division at my public health centers is not easy act to do also. Delivering the information to the population is also not. Sometimes they ask me to have sex with them, and then sometimes they have talking about anything, talking about inappropriate thing. Sometimes it's also threatens me. So it's really not easy to interact with them sometimes, but we have to get to know better about the characteristic of the population, because I am working with specific population, men who have sex with men. So men, if they have depressive condition, it's not really easy to make them in equal state of mental health status. It's need efforts, needs experience, needs assertive communication. It needs well-behaved communication, so you can protect them and also protect yourself from harm or social violence to yourself or from others. And then also about your second question, how is the nurse's role in this type of strategy, HIV self-testing? There are so many roles that you can provide to your population or to your patient, to your communities. You can be advocate. It's not really an easy task to starting over the HIV self-testing, miss, but because you need so much effort, you have to ensure them this is safety, you have to provide them with sufficient information, and it is not an easy part to do. But when you getting started with this type of strategy, it's quite satisfied because you reach out the population more, small but more. Yeah, my achievement is not really big like Profco. Profco is in the higher level, but I'm just in the local context. I only test like 45 to 49 MSM to get self-tested because my financial budget is really tight. And then to be advocating the needs to fulfill the resources, and then the kids, it's really hard to achieve also, but it makes you quite type of an advocate. And then also you have to be a counselor. You have to think people-centered approach. It's not about you, it's about them. Sometimes it's not easy. Sometimes it's also make you exhausted. It also make you burn out when they keep talking about them, but they don't really realize on specific situations that we also need to be get paying attention by anybody else. So for being a counselor is not an easy mode. Also, you have to widen your communication skill, your competency about understanding other, active listening. So your role is really obvious right there. And then so an educator and then also provider. So this is your actual role. There is no doubt nurses is playing important role in the HIV eradication progress. Itu Mbak Sumiati. I hope or I wish it will answer your question.
Okay. Yes, I think as you mentioned before that it's not easy, right? So
Yes.
in my opinion, when someone do HIV, ST, or something like even they do the test themselves, there must be someone to accompany them, just to
Yes.
provide support when they
Yeah.
know that they are positive.
Yeah.
So there is someone beside them, so we can avoid them to hurt themselves. Right?
Yeah,
So,
it's challenging, really.
yes.
It's quite challenging, and then also you can also see them from far away by using technology, so they can do it in front of you by using Zoom meeting or video calls only, and then it will help them so much if you practice at them when they perform the test. And also, I also heard so many things about the strategy. I mean, like, because I'm helping the men who have sex with men, so there is also so many harm conversation that leads to me. So people keep judge me, and then what are you doing? You are doing something is not really good. What? Why do you help such type of people? Sometimes it's really heartbreaking.
Yes, yes. I mean, yes. Build. I think. Build. The resilience is more. Is
Yes,
important
yes.
too. Yes.
Yeah,
Before the test and after the test.
yes, resilience is the key.
Yes. Okay. Thank you, Mr.
Yeah,
Mahati.
Mbak Sumiati.
Thank you so much, Nurse Sumiati Sinanda, for your question, and thank you so much for Nurse Mati for your answering the question. Well, time is out for Q&A. Well, before we close our session for webinar International of HIV in the second session, let me to the conclusion for our discussion of today. So our session is talking about we must campaign and reduce the stereotype of, and then we need to build the strategies to reduce the stigma itself. Actually, we are as a student itself, we can campaign by the little thing. For the example from our social media, we can campaign how that is the stigma it comes and to reduce the stigma, and then we can give health education for people in social media. That's what is the HIV/ST or HIV self-testing. Thank you so much, Nurse Mahathir, for sharing with us. Yes. Before we close our sessions, let we give our viewing or the showing about this, giving the certificate. Okay, committee, please showing for the air certificate of Nurse Mahathir.
Yeah, I accept that virtually.
Okay, thank you so much, Nurse Mahathir. Okay, thank you so much.
It was an honor for me to be with all of you.
Yes, thank you so much. We hope we can meet directly, and I hope we can meet in Samarinda and you can come to our campus.
I will, because I have.
Okay, okay, we're waiting for it. Okay, thank you, Nurse Mahathir. Thank you for all of the participants, and come back to our Master of Ceremony. Thank you.
Okay. Thank you for our speaker today. Nurse Mati for the informative and knowledge which have been given to us. May it be useful for us. And thank you so much too for our moderator today guiding in this session. So we have a last session again. So for all of the participants today, have a nice seat. Prepare yourself. We must to move next session.
Okay, ladies and gentlemen, kita akan break sejenak untuk 15 menit terlebih dahulu. Teman-teman pastinya ada yang ingin minum juga dan ke kamar kecil. Kami persilakan, kita akan break sejenak 15 menit. Kita akan kembali lagi 15 menit yang akan datang. Terima kasih.
teman-teman buat melihat prodi S1 Ilmu Keperawatan di ITKAS RAS. Yuk, sama-sama.
Jadi, di sini biasanya para mahasiswa itu belajar mengerjakan tugas bersama serta bertukar pikiran bersama. Di sini juga kami yang ada tingkat dimentori oleh rekan-rekan kami untuk berlatih bersama.
Melakukan bimbingan.
Oke, jadi dalam menyusun latar belakang ya kita harus memperhatikan poin-poinnya. Jadi kalau kita mau menyusun latar belakang ini harus bisa menggambarkan yang kita tulis itu apa. Ya, coba kalian cek di halaman 1, coba dilihat di situ ya. Nah, coba kalau kita lihat
Baik, sekian perkenalan dari kami tentang program studi S1 Ilmu Keperawatan ITKES WAS. Sampai jumpa.
Okay, ladies and gentlemen, welcome back to International Webinar 2021 Institute Health of Technology and Science via Tausada Samarinda. Okay, ladies and gentlemen, the next session, our last speaker from Institute Health of Technology and Science via Tausada Samarinda, Nurse Kiki Ardiansa Safitri, Master of Nursing, Specialism Medical Surgery of Nursing, with topic Life Skill for Adolescent Response of Gender Dysphoria, with moderator Melinda Bit from Student of Institute Health of Technology and Science via Tausada Samarinda. Hello, Melinda, can you hear me? Hello?
Yes, Metro.
Okay, time is yours.
First, I will read the curriculum vitae of our third speaker today, Nurse Kiki Hardiansyah Safitri, the head of Nurse Profession Education Program Study in Institute Health Technology and Science via Tausada Samarinda. Her education is start from 2006 until 2012 in Universitas of Andalas as a Bachelor of Nursing, and then continue her magister in specialism in medical surgery in Indonesian University in 2030 until 2070. And her work experience not only in Institute Tech Health and Science via Tausada Samarinda, but also as a young lecturer in University of Andalas and in Universitas Indonesia. And then her clinical academic experience, not only in, of course, in East Kalimantan, but also in Java Island, in hospital, in Jakarta, and then Padang, and of course, as a supervisor, not only in East Kalimantan, but also in Kota Padang, Bogor, and then Jakarta, and then Balikpapan. And her research and publication also in nursing student perception of the role of clinical instructor in clinical practice coaching for patient safety in 2014. In Riau International Nursing Conference, how evidence-based in our practice. And also in 2019, risk factor that cause end-stage renal disease in productive age women that undergoing hemodialysis in East Kalimantan, Indonesia, at the second Andalas International Nursing Conference in 2019. And of course, speaker in some seminar like renal replacement therapy nursing symposium, and nursing care in patients with chronic kidney disease in 2019. Okay, that's all about our third speaker today. And don't forget, like my other moderator say, that we only have two sessions. That's the first session is 35 minutes for the presentation, and then the next session is for Q&A session for 15 minutes. So for all participants who have questions, you can press the raise hand sign on Zoom meeting or write the question on the Zoom column chat. And then, Nurse Kiki, can you hear my voice?
Okay, I can hear you. How about my voice? Is
Yeah,
it
it's
clear?
really clear.
Okay.
Okay, you can start your presentation.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you for the chance to present my topic with life skill for adolescent in response of gender dysphoria. Thank you for organizing committee for a chance to me, honorable to me to give you all the presentation about the HIV trend issue, and I'm so surprised about this webinar because I got a lot of knowledge about the trend issue the other country. Thank you, Prof. Ko, for the sharing about the trend issue and preventive in Taiwan. And the second speaker from Andalas University, for Mr. Mahat, thank you for update about the HIV testing. And we also know about the HIV testing, simple as like glucose test in diabetes mellitus patient. And now we talk about the far away from the HIV, but also get the impact to make the increasing of the number of HIV. Okay, let me share. Okay, why adolescent? You can see the picture. I have a picture about adolescent. Not the begin of the human life, but adolescent in the middle, but not middle, but not the last, but the point of uh, the vital stage that human life circle, you know, after have we see the child, then a teenager, adolescence, and after that get a maturity to get suppose and have a child, and after that we get uh gerontic stage, and the life cycle of human start with adolescent, because adolescent and is a transformation stage from the child to the maturity one. And the adolescent also stage when the young extend their relationship beyond parents and family and are intensively influenced by their peers and outside world in general, most crucial and impulsive and influence intelligentsia and stamina. And is it time for achievement? Adolescent is time for achievement. Deciding profession, you wanted to be a doctor, you wanted to be someone, and that you have dreaming on, and developing personality, and emotional instability, because you wish something and you try to get the top of the dream, and after you have the dream you can get achievement. After you can get it, you can be low motivation and you can be depressed. So emotional is not stable in adolescent. And we know adolescent years of risks ahead. You're not a child anymore. In adolescence, you have taking responsibility something and full of stress, of emotional stress, giving a negative pressure about environment to you because they are need some thing in you. At adolescent get uh, to have to must fulfill the other person to make dream on and have taking uninformed decision. Why I say informed decision? Because uh, all the people around the adolescents need adolescents be immature. So the sum of decision to make their own ways, something like you can go to the other university, you can be a doctor, you can be a nurse, you can be a technician, and you can be someone that you dream of, but it also decision for your mind and your body. So the other people need you have independence ones. And the last but not least is their sexuality in adolescence, in a transformation from the child until have we going to maturity in sexual and get a baby, get a spouse, and something like sexual characteristic to perform the characteristic of sexual. And we know sexual development in uh, adolescent have uh, challenging because someone thinks they are already man, someone thinks they already a woman, or someone thinks the girl from the baby until they going to date is a real girl or real a woman. But the other person, the other people thinks, why I be I am a woman, why I am a man. I think I'm not discomfort with my secondary sexual characteristic. You know, in a man you have a hairy, you're full of hairy in your face, in your underarm, your in your chest, and in your leg, in your arm is so hairy. And the other side, the girl thinks, what happened in my chest? What happened? I have something not different from the others. What happened in my in my rutinitas? What is menstruation? I'm confused about it because maybe some of child didn't have pretending, uh, didn't have parents to tell about how they are going to be girl, how they are going to be men, and so they are confused. After beside that, the gender dysphoria is caused about the hormone, the unstable hormone in a boy and unstable hormone in a girl. In hormone in a boy, we also know about androgen or testosterone, and the girl is we know or also know estrogen have a balance. And after we have a maturity and sexuality, or in adolescence one, the testosterone increasing in a boy and estrogen increasing in a girl, so have a sex appearance, secondary sex appearance in a girl and different with a boy. But if have uh, I need something to tell about myself and confused about my sexuality and confused about my gender. Gender and sexuality same, but not everything same, because the sexuality is you get from the baby's one, but a gender is a role of the sexuality. So some people thinks I'm a girl and my gender is a girl, but the people can think I'm a girl, but my role is a man. So the gender not 100% same with the sexuality one. And so this is gender dysphoria. You look your own body with the other experience, like a boys, like in my mirror, I'm very happy to see me like a girl. And the other one, in the mirror, I'm very happy. I'm very happy with. I'm very happy with boys look like. And so this gender dysphoria is a condition in which a person has more incongruence between expressed and experienced gender, the biological sex at birth. Individual with gender dysphoria experience strong desire to be treated as the other gender or the alternative gender different from their assigned gender, and or to be read their sex characteristic and the strong conviction of having feeling and reaction typical of the gender. For the most children, the gender dysphoria, whether gender will persist or disease, will probably be determined between the age 10 to 12 years old, although some may need more time. Evidence for the 10 available prospective follow-up study from childhood to adolescent review the study indicate for the 18% children who meet the criteria gender dysphoria and decrease at the pubertas. You also know when the child he confused about the gender. I'm a girl, but also playing with the boys. I'm boys, but also playing with the girl. And after puberty, you have a specific characteristic of the sexual appearance, and so the gender dysphoria in the childhood decrease number, almost 18%. So you can show the real you are, the real your gender are. Instead, many of these adolescents will identify non-heterosexual. Non-heterosexual is mean homosexual. Some of study when they interview adolescent with different outcomes of gender dysphoria, then mention social environment and anticipated result of the bodily changes. It's mean like the other environment look like me in a boy, the other environment like me as a girl, maybe environment and influence for the parents happy to see their daughter become boys, and I think I'm comfort with this appearance and the environment not things I'm different, but things I'm a unique one. So the perspective of the gender dysphoria persistent until they know about the role of sexual and got a marriage, must get a married. I'm not married and a man because I love a girl as a girl. I don't wanna married with girl because I like men, because I feel like man, something like that. So the question is, why so essential? Why so essential? The lack of the knowledge of parents and adolescents set information by own itself. What happened to me? A media social and group with the current same condition. Yeah, it's mean the same condition with me. So I'm comfort because every people like me. I'm comfort with this group because some with me, but they didn't know, they didn't realize because it gonna be changed because the real one can approve the social not approve you as the gender dysphoria because the culture in Indonesia have very strict about the gender, just know about men and just know about the woman. the other country may be open-minded with the others gender, yeah, like LGBT one. So in Indonesia, have a discomfort zone in the other people when the other people think I'm not the same with the other one because I'm gender dysphoria. So I talk with the gender dysphoria too on also talks in LGBT community, and so I become community. I become LGBT in the end. So this is so essential. Why this is so essential? Because the confusion adolescent not have a platform, not have a home to talk with the express their feeling, the confused feeling, and so after that, day by day, year by year, the increasing of the LGBT can we found in Indonesia, and also we have found in this year and increasing year by year. Lack of parental support was associated. I feel some of my friends with the LGBT community have far away from their parents, and because a lack of parental support, they think I'm just make myself happy, and I don't think the other ones because I supposed to be happy and with the my own ways. So the information about the LGBT is lack, especially from healthcare, and LGBT is a taboo, and LGBT is not one of the current situation that we must concentration because we are minoritas in Indonesia, so the increasing number LGBT supposed to be HIV/AIDS. Yeah, we know related of HIV concern, manage risk factor. Prof. Ko also describe us the managing risk factor is one with PrEP, and the managing risk factor that Mr. Mahathir tell us about the use use screening in HIV test with manage people with life factor. And the end, manage patient with the HIV. Yeah, we can use ERV, antiretrovirus, and social therapy, reduce stigma, empowerment patient. Prof. Ko tell us about the peer group when the patient with HIV positive to tell about her experience in being patient of HIV and spread the information to school and school to public how to be how feel the patient feeling after they got HIV virus and after we go to hospital and now I'm HIV positive and spread to the other person to cut off the transmission and cut off the increase in number and cut off the stigma. So it's a managed patient. And the second period before managed patient, we also need manage people live with the risk factor. I'm not HIV positive, I'm HIV negative, but I live at risk factor. Prof. Ko tell us and Mahathir tell us about the HIV test, about HIV test to reduce and know I'm HIV positive or not, and I use PrEP to preventive to get HIV positive. And I also to tell you about how to manage before the risk factor happen, how to manage before the LGBT happen, to make the children far away from drugs, to manage adolescent to far away from the risk factor, even LGBT, even they are the other risk factor like free sexual, and we tell about it not from they are adult, but we also teach the adolescent, we teach child, and we teach parents, yeah, the target community, that we can prevent this HIV virus from parents, from the adolescent, and from the child. Yeah, the zone of the before risk factor have of nurse,
Recording in
we
progress.
also need behavior changes. The challenges of the nursing area, uh, not only to cure, not only to give a nursing care, but also give a nursing education, nursing promoter, and we also make changes behavior to get healthy behavior ones, yeah. And adolescent, we also know 3 life skill for understanding about the life skill adolescent. Life points, 3 points, the life skill for understanding and self-management. There are self-esteem to proud yourself about how your achievement you are, and self-awareness and assertiveness. And we talk about more about assertiveness, because if I tell you one by one, it's not enough for the time. We can discussion with the another meeting. And the coping with stress, and coping with emotion, and life skill for knowing with the living with others, effectiveness communication, how to maintain communication with your parents, with adolescents, the other people, peer group, with the siblings, with the parents, with the uh, supervisor, with the teacher, and interpersonal relationship, empathy, conflict resolution, and critical thinking, creative thinking, decision making, and problem solving. The point of the life skill is change behavior. The point of the life skill is change behavior. What is assertiveness? We talk about assertiveness. What is assertiveness? Assertiveness is I believe my way is the right ways, the best ways, but we believe decide depend on norm, like religious norm, social norm, culture norm, and we concern about uh, the influence from the other environment, and we talk about the influence with the good communication to the parents, and tell about challenging for the environment one, and I'm confused about myself and not easy to speak up. I have a confused with myself. I got depressed and got stressed because uh, majority of the adolescents not good communication with the parents. So we have one project to make parents know how to communicate with their son and their daughter, and we also give information how to maintain adolescent area or adolescent zone, because the many of the parents didn't realize they policy and their right in home make depressed to their son and their daughter, and this maintains a relationship with daughter and the son is not easy. So if become a parents, we also know about the counseling, and we separate information to help parents know the area of the adolescents, the area the stubborn adolescents, and we need know about the adolescents area, not parents area, and assertiveness can be realized with the parent try to get open-minded with the area and the situation, and this situation be different with uh, when I was young. Don't use when I was young, but use this area, this phenomena happened in these years, not in 1982, 1970, 1980, in different area. How related and LGBT, what is related LGBT? We know about the assertiveness, how to can build assertiveness. When I say no, I don't wanna accept your mind about the LGBT one, about the area of different mind with me, because I have culture in my home. I have mother and father, I have grandma and I have grandpa to teach me how to be a good man, how good girl and good woman. And if I become transgender and become homosexual and I become bisexual, I must realize I'm not live alone. I'm live with a family one. If it happen, I must talking, yeah, communication, have a communication skill, and we build communication skill parents to adolescent. The communication in adolescence is start from the parents, not so from adolescent, because adolescent have think in development tax. Want to independent from my parents, so we have counseling to parents to make the adolescents realize that a problem have a solve together, not only by their own self. And self-esteem, you must love yourself. I have several posting in Instagram tell about one family with two daughter, and they teach how to make love herself with, if I have a rush in my face, I love myself. I have not a good in even I have not good in drawing, I have a good in singing, I love myself. And they try teach her daughter with say I love myself. Wherever I have a red rose in my face, I love myself. Nah, and the parents could know about the information to make the teenager, the adults, and the daughter, the son to love herself, and teach about the how to communicate is the core problem in adolescent have didn't know how to communicate their feeling to the other person. Maybe they want to get a group with the same condition, and how to make build communication is not easy anymore today, and but still have change with a positive mind. And we all do with peace PK. In Indonesia, we also know about the peace PK PSPK, the program of health ministry and Health Indonesia program with family approach. And so everything that wants to make be changing start from a family, and family center is one way to make the dysphoria gender solving, make depressed and stress to child and adolescent solving, and we can build a program to solve all with the Health Indonesian program with family approach. Next term, we can ask you and we can discussion about more about the PSPK. Okay, thank you for attention. This is all my presentation. I came back to Melinda again. Thank you.
Well, thank you so much, Neskiki, for the such informative and interesting material. So today we will enter into the next Q&A session for minutes. So for all participants who have questions, you can press the raise hand sign on Zoom meeting or write the question into the Zoom column chat. So any question from the participant, you can raise your hand. Okay, we have one question in the column chat that say from Grace Ophelia. Okay, Nurse Kiki, how about bisexual that come from dysphoria or that's come from another factor? So what about it, Nurse Kiki?
Okay, wait a minute because I have much electricity. I have a little bit. Okay. About the bisexual. Bisexual is unique. I think it's unique because the trauma of something make them get away from their
Recording stopped.
role dysphoria, role gender. Sorry. Gender dysphoria love herself with the other's role of gender, and bisexual one, they love their gender. They know the role of the gender, but I'm curiosity with the other gender, and I think it's possibly to me to love the other person with the other gender. And how make it happen? Because the trauma of the relationship, in my opinion, and in my my friend experience about the bisexual, the trauma of relationship with the man, they think the woman knows about me, but I'm not restrict man if the man love me, something like that. So the bisexual happen not from the begins of dysphoria gender, but the bisexual happen after they didn't know about the other role of the gender, because I think I'm normal, but I'm curiosity with the other gender, and when I try it, I feel comfort because I have some example. I feel man is the person that can make me happy. The man is one person that can make happy. I need prince to make to fulfill my life, be a completely. But the same times, my prince didn't come, but the man comes. I dream of the prince to come me, but the prince didn't come. The man comes to me, and the man comes to me is not a prince, so I disappointed about him because She not look like the prince in a cartoon, the prince of film, make me as a princess anymore. And the other side, there is gender, the other gender, and a woman have get a fulfill me to make me happy too. I'm not I'm not rejected. I feel comfort too. This is a bisexual. You can approve a man, and the other side you can approve a woman, as long as you disappointed with the one gender and the other gender fulfill your satisfaction. Maybe it's not from the begin of the gender building gender, but begins when you trauma. In my opinion, so far as know, and we read some of uh, uh, material reading that a bisexual not come from the begins of the life, but also development when they are something happen, where there's something happen in their life in the middle of their life. That's it. Thank you.
Okay, thank you, Nurse Kiki. So, bisexual is not start with the gender dysphoria, but in Nurse Kiki experience, yeah, it's about curiosity with the other gender or have some trauma with a relationship, and then they start to new what we call it sensation.
Yeah, new sensation with the other gender.
And, yeah, and then they feel comfortable about it, right?
Yeah. Yes.
Okay. Okay. So thank you for the question. Okay. So is there anyone who want to ask personally, or you can unmute your Zoom? So I will give you permission. You can raise your hand.
Luciana, raise
Okay.
hand, maybe.
Okay, Luciana. You can ask.
Thank you. Before to moderator Melinda Bit, so I would ask to Nurse Kiki how to reduce stigma about gender dysphoria to all parents with high religious belief, and what intervention can we give to them, because in the fact not all parents can accept their children with gender dysphoria. That's
Okay.
all from me. Thank you so much.
Okay, gender dysphoria describe. We also know the child have a gender dysphoria, and after adolescent, we can see the specific gender dysphoria. I think is strong characteristic from than the children ones. So after adolescent, he show the comfort with the breast, maybe the example, the comfort with the long hair. I'm comfort with the short hair, maybe sometimes, and I'm comfort with trouser. I'm not comfort with the skirt. We also have seen from the kindergarten maybe, but people didn't realize being a parents have a skill to being be a parents. I mean something like this. You all of you is a parents to be. All of you is parents
Recording
to be.
in progress.
Yes, and also if you think you can, you have a child, you set the mind of concept to being a parents. So, if you have a knowledge about the characteristic of the man and characteristic of the boy, characteristic of the girl, and a characteristic of woman, you also sensitively from the baby ones, where the baby girl have a sprinkle with hair and with the pink trouser, pink dress, and also look like a girl, because the baby ones can be girl, can be boy look like. And if you are parents, you can dress up your daughter or your son like a sexual, biological sexual from birth. Yes. Now, after child, you dress up your boys like a boys. You teach boy like a boy one. Mother can be a father. Father can be mother. Mother and father have a good team as a good team to teach him they boy and they girls. It's samurai the same way because mother can be a father, father can be mother. So, if you a father, you teach your boy to practice football or soccer maybe, and when you are a mother, you teach your girl to have cook some food maybe something like that. And why about the parents have divorce? Why about the parents have a long distance marriage? The father far away and mother far away, and mother must teach as a boys. Wow, how to teach as a boys? I'm not a man. You teach boy to lead you salat maybe. You teach a boy to say doa maybe because a boys elite doa in my religion, something like that. And after that happened, dysphoria happened in the adolescent, we uh we realize about how past I teach my girl, how in the past I teach my boy. So if there happens, I think I have explained this foreign genders not because social impact and environmental impact, but also about the hormone impact. So if there are something uh, to to describe about the dysphoria gender, we also get examination about the blood hormone in estrogen, testosterone, and androgen to know about you have a lack of hormone or not. But in some of research I've been read, uh, the therapy of the gender dysphoria not about just cognitive therapy, behavioral therapy, but also medical therapy. So we have to just open-minded when boy and girl look like the other gender and stop it with realize as far as possible. Don't wait uh, the adolescent to show you I'm not like boy anymore, mom. I'm not like girl anymore, mom. And maybe they are not speak, but just show about their their daily activity like a boy and like a girl maybe. So we must have a persuasive with the parents one, and this is not easy because we have to realize, but year by year we must do fast as possible because we must spread the information widely so the people and the parents to be know how to teach the boy to teach the girl like sex biological, not about the crossing anymore. If they are possible happen, we as far as possible we know, and the end the gay and bisexual and lesbian didn't exist because we treat from the beginning of this gender dysphoria. Okay, and to reduce stigma in my opinion, to spread information widely so the parents to be knows what happened in the child before they got a child, something like that. Thank you.
Okay, thank you so much, Naskiki, for your answer about uh, parents had to be know about their child first. So, okay, next, if there are any question from, okay, we have one Okay. Please, Christian.
Thank you, moderator. Let me introduce myself. My name is Christian Erlangga. I am a student of Institute of Technology, Health and Science Wiatosada Samarinda. And please, my question is, are there any particular tricks from Nurse Kiki for teenagers to face gender dysphoria? Because sometimes for them it's so embarrassing and sometimes it's taboo to say. They don't want to tell anyone about it. Thank you. Just said my question.
Okay, nice question. When did that come back to you?
Okay, thanks, Kiki. That's our last question from Christian about are there any particular tricks that from you about teenagers to face gender dysphoria, and because sometimes they think it's really embarrassing and it's sometimes taboo to say to parents or maybe their friends about it, and that's why they don't want to tell it. So any tricks for you from you, Miss?
Okay. Even I'm a specialist in medical surgical nursing, but I'm still have a concern in adolescence area. In adolescent area, in the community nursing, we have aggregate in adolescents. In community nursing, have aggregate in adolescents, and we can catch them in a school when they are have a characteristic in gender dysphoria. I have some research so screening gender dysphoria in Samarinda city. I have 20% of the junior high school being gender dysphoria characteristics based on screening that we spread to school, and we have the result, and I so surprising about it. And how to trick they can open the status being a friends. You know, adolescent in development text is being a relationship with the other person, get a relationship with the other spouse, with the other gender, and being a friends is a peer group in adolescence is effective to ask about the feeling. So if you want to ask the sensitive one to be being a friends, after you have a good relationship and being a friends, they can tell you more. In my experience in this very gender, my participant in my research far away from the first we have a meeting. We have meeting in the begins of my research. So shy and so close people, not open to answer my question. After we meet the second one, the third one, the fourth one, we can ask like a friends. We can ask like someone that not stranger anymore because they feel comfort. They can speak loud about their feeling and their experience about the gender dysphoria. Is the first trick. The second trick is we spread information like this seminar. We spread information from school to school about gender dysphoria, and we take the tagline. If you think something happened in you, and you think in the mirror you wanna be a girl, as you a man, you can call me. So the second trick is based on needed, based on something that you can feel I'm not comfort and I want to tell someone. Then I don't want to tell to my parents one because my parents will be angry with me. So You can tell your peer group, you can tell the counseling one to spread the information, to tell about this feeling, to solve the the problem. So the one is you get the ball from your participant, your patient, your adolescent. The second one, you meet her as a personal, yeah, and being a friends, and tell about a story, long story about some case, and they can describe their feeling as long they can speak. And after that we have time to make information to get a good way to describe how they are going to be and how to solve the problem and how to communicate your feelings, something like that. Thank you.
Okay, thank you so much, Nurse Kiki, for your answer about how your tricks, yeah, about how can they be open to other people about their gender disorder. And the first thing is we have to make a relationship and then spread information like a seminar or the school to school, and then they gonna feel, they will feel comfortable and will be more open again. So I think that's the last question. And all participants finally we come to the end of discussion. So before I close the presentation, I take a conclusion. So adolescents in this time are time of full race, full of pressure, and it's hard to make decision. And this time, also sometimes there are many challenges and question about their sexuality or gender, and they think that their sex appearance is not weird, but it's normal. But as Nurse Kiki say, we need to manage the risk factor before the case show, and we need to teach the adolescents, not the adolescents, but the parents too about it. And of course, life skill is for behavior changes or to change the behavior to be a good one. And life skill is like for self-understanding, like self-management, like coping with the stress or your emotion, and then knowing and living with others, dealing with issue and problem. So in Indonesia too, we have PISPK, that's Indonesian program for family to solve the family problem. So I think that's all from me, and I'd like to thank to our speaker for the informative interesting presentation, and all the participants for a very active participant. So finally, give the applause for the speaker and all of you. Okay, before I return it to the MC, we will symbolically give a certificate for you. And again, thank you very much for the informative and your interesting presentation today, Nurse Kiki. Yay! Dankeschön. Yeah. Okay. I think that's it, and I will return it to our MC, Hendro and Yulita.
Okay, thank you so much, was moderator Melinda B. Thank you so much. And thanks to our last speaker for today, Nurse Kiki Hardiansa Safitri, Master of Nursing, Medical Surgery of Nursing. Okay.
Yulita and Hendro?
Yeah. My voice is clear?
We cannot hear your voice.
Hello? Hello? Okay. Okay, thank you. Thank you so much for moderator today, Melinda Beat. Thank you so much. And thanks to our last speaker for today, Nurse Kiki Hardiansa Safitri, Master of Nursing, Medical Surgery of Nursing. Thank you so much, the information and knowledge which have been given to us. May it be useful for us, and thank you so much to our moderator today.
Thank you so much, Hendro.
Okay, you're welcome. Well, ladies and gentlemen, finally we get to the last session in this event that is closing. Let's close this event by saying Hamdalah. Alhamdulillahirabbil alamin. As the master of ceremony, thanks to Professor Konai, Register of Nursing, PhD from National Chengkung University.
And then Nurse Mahathir, Register of Nursing and Specialist of Community of Nursing from the Faculty of Nursing, Andalas University.
And last speaker, thank you so much, Nurse Kiki Hardiansa Safitri, Master of Nursing, Specialism, Medical Surgery of Nursing, lecturer from Institute Health of Technology and Science Wiatausaha, Samarinda.
And thank you to students from National Chengkung University, all of students from Institute Health of Technology and Science Wiatausaha Samarinda, the committee, and the audience entirely. May we has had conducted will be useful for us. Maybe we move to the next session is a documentation session. So let's we take a picture together. For all of our participants, let's open your camera, so prepare yourself. We will take a picture together.
Iya, jadi kepada seluruh para hadirin, partisipan yang masih berada senantiasa di Zoom meeting kita pada hari ini, kita akan melakukan sesi dokumentasi bersama seluruh pemateri dan tamu undangan kita pada hari ini. Pastikan teman-teman memberikan senyum terbaiknya. Kita akan memulai dari slide pertama dalam hitungan 3, 2, 1. Slide 2, 3, 2, 1. Slide 3, 3, 2, 1. Slide 4, 3, 2, 1. Okay, the last slide, right? Smile, 3, 2, 1. Okay. Thank you so much. Ladies and gentlemen, even guiding the event, I made mistakes. Or when someone here, please forgive us.
Yeah, thank you for our progress. Session 1, 2, and 3 until now. So we have to. Sorry if in our session we have a mistake we have to do. And
of course, and I am Hendro Ardi Pratama.
I'm Yunita Safera Hurai.
See you next event.
Bye-bye. Always be happy and healthy, everyone. God bless.
Bye-bye.
Jauh di mata, kun mangsan saya berkuliah. dengan